Sankapushpi can be given in Pakshagata due to cerebral infarctions. Hemiplegia due to cerebral infarctions. Sankapushpi Rasayanam should be our drug of choice because we have seen that the modern researchers have suggested that it helps in the reperfusion of the ischemic changes. And also, if Pakshagata is associated with epilepsy, Sankapushpi can be given. If any neurological disorders is due to any infections or toxins, then also to your prescription we can add up Sankapushpi because all that activities of Sankapushpi were established by researchers. So next is Manduka Parni. So we all know about Manduka Parni. It is also a very good major rasayana. It is having, the modern researchers have said that it is anticonvulsant in action, sedative in action and increases dopamine levels. So Manduka Parni is one of the best drug of choice in Parkinsonism because we all know that Parkinsonism is due to decreased dopamine levels, and when we give Manduka Parni, it will act against that condition, and also it is very good anti-stress activity. So here I want to talk about Sahacharadi Kashaya clinical implication, because if you take Sahacharadi Kashaya finishing, yes, only 2 or 3 slides. Sahacharadi Kashaya, if you take, it contains only Sahachara, Devadaru and Shunti. The modern researchers say that Sahachara is anti-Parkinsonism inactivity, and Devadaru is anxiolytic, antidepressant and anticonvulsant, and it is a neuroprotective agent. And of course Shunti, we all know it is antioxidative in nature as well as neuroprotective in nature. Now come to the slokam of Sahacharadi Kashaya. What does Sahacharadi Kashaya tell us? Pavana pidita deha gati pibandataha vilambatage bhavati chaya. That is, when a body is having excess of water and when the patient movement is getting disturbed, and if you want to have that movement in your control, then you have to take Sahacharadi Kashaya. So in all disorders pertaining to the movement, like in Parkinsonism, cerebellar ataxias, choreiform movements, senile tremors, in all such conditions, Sahacharadi Kashaya can be your best drug of choice. So next is Brahmi Vati. We all know Brahmi Vati, it is a very good major rasayana, but Brahmi Vati is told to have Mastishkya Hridayasya cha api dorbalyam. So when some neuron degenerations of the central nervous system, we can very well give Brahmi Vati, and at the same time, even when you are emotionally disturbed, because it is Hridayasya cha api dorbalyam. So in all psychological manifestations also Brahmi Vati can be added up to you. Next one is Brahadvata Chintamani. So you all know Brahadvata Chintamani contains Swarna Basma, it contains Rajata Basma, Adraka, Loha, Suta Basma, Mukta Basma, along with Kumari juice. So if you take Swarna Basma, has the potentiality of crossing the blood-brain barrier, and Rajata Basma has the potentiality. Researchers, it's not me who's saying, all the researchers have shown that Rajata Basma can has a very good neuroprotective activity by decreasing the inflammation produced by the microglia. So Brahadvata Chintamani is a drug of choice in various neurological disorders. For example, before we have seen Sankapushpi is the drug of choice in Pakshagata due to ischemia. Suppose if it is Pakshagata due to hemorrhage, then Brahadvata Chintamani should be our drug of choice, because Brahadvata Chintamani says Vata Rogan Pitta Kruta Nihantina Atra Chintanam. So something which is a Pitta Roga which is exhibited in the form of a Vata Roga, then Brahadvata Chintamani should be your drug of choice. So here I don't want to talk much about the autoimmune disorders, because we know it is something where our own system becomes our non-self. And when we come to the management principles, see, in autoimmune disorders, I feel that 3 doshas are involved. Because in the first stage there is Dhatu Mala Sanchaya, in the second stage there is Dhatu Paka, and in the third stage there is Dhatu Kshaya. So Dhatu Mala Sanchaya is Kapha, Dhatu Paka is Pitta predominant, and Dhatu Kshaya is Vata predominant in nature. So all the 3 doshas have to be addressed there, and most importantly, to prevent Dhatu Paka, Gruta is the best drug of choice, and after everything, Rasayana plays a very important role. So when we see rheumatoid arthritis in the initial stage, when there is dhatu mala sanchaya, you can have amrudottara kashaya or rasnerenda kashaya for pachana, deepana and pachana. At least you can have simple even vaishvanara churnam, and to prevent dhatu paka amruta gruta, and for vata predominance rasna dasamula kashaya. And if you feel that there is excess of pain and excess of deformities, then you can go for bhallataka rasayana. Rasayana plays a very, very important role, because at the end you are going to see the dhatu kshaya avastha. So bhallataka rasayana. And if you see that there is excess of muscle loss, then you can go for drugs like vidaryadi gruta. So above all this, these are Ojo Pustikara Bhavas which increases our immunity. So among them, first is the Tattva Gnana. So I don't know how much my presentation gave a Rasayana boost up to you, but Tattva Gnana, Hitahara, Kshira, all these are considered to be increasing your immunity. So our Acharyas clearly said, Ahara, Achara, Chesteshu, Sukhardi Pretya Chehacha. Param prayatna matiste buddhiman hita sevinam. So be very, very vigilant on what you eat, what you do, and what you think, because only these factors help us to have a very good immunity. And if we have a very good immunity, we can enjoy our life, because life is beautiful. Thank you one and all.